Dear Chairman, dear colleagues, let me present you my first year progress report. My PhD topic is prognosis and survival for urinary bladder cancer. My name is András Kubik. I am working as a urologist since 10 years at the Department of Urology, and I was able during this period to perform radical procedures, both open and the laparoscopic way. And since last year, I'm a PhD student, and I would like to synthesize my practical knowledge with the up-to-date scientific data in urology. So my vision is to empower patients through excellence in the care they receive from me, and my mission is to provide high-quality care for people with urinary bladder cancer. So my specific goals are, for the first topic, to find biomarkers like MMP7 to prognose the patient's survival, and this was a combined registry and meta-analysis. And in the second topic, we investigated a rare bladder cancer subgroup for neuroendocrine tumors, and we performed a systematic review and the meta-analysis. So it's a combined registry and the meta-analysis. We investigated MMP7 as a prognostic biomarker. And you have to know about urinary bladder cancer, which is the second most common malignancy of the urinary tract, with more than 200,000 deaths annually. And most of the cases are non-muscle invasive bladder cancer cases, and they can be treated by the minimal invasive way transurethral, and they have a very good prognosis. But about 20% of the cases are muscle-invasive bladder cancer, and the most significant prognostic factor for these cases are the lymph node metastasis. That's why the gold standard treatment is radical cystectomy, lymphadenectomy, and perioperative chemotherapy. And despite of these radical procedures, only half of the patients will survive, and only half of the patients benefit from these radical procedures. And that's why we need good prognostic biomarkers to find the patients. And our aim is to assess the prognostic role of MMP7 in urothelial carcinoma patients. We investigated matrix metalloproteinases because they suffer tumor growth and progression, and this ability made them good for prognostic biomarkers and maybe as therapeutic targets as well. And why MMP7? Because its elevated levels in serum, urine, and tissue has been validated in different patient cohorts, and it has association with lymph node metastasis, and it is an independent and unfavorable prognostic factor. The prognostic value of serum and plasma MMP7 levels has been validated in different patient cohorts, and assessing more than 400 proteins, MMP7 was among the top 5 proteins as a biomarker. So we drafted 2 questions. The first was for our registry, and that was, do patients with elevated pre-operative MMP7 levels have worse overall survival rates? We used the PICO framework for muscle-invasive bladder cancer patients, high and low level of MMP7 levels, and the main outcome was overall survival. And we hypothesized that muscle-invasive bladder cancer patients with lymph node disease and high MMP7 levels have poorer prognosis. We had 2 different registries, one from Essen between 2008 and 2013, with 87 muscle-invasive bladder cancer patients who underwent radical cystectomy, and we measured the pre-operative MMP7 levels. And the second registry from the Semmelweis University between 2014 and 2018, and with 68 muscle-invasive bladder cancer patients, and we also have pre- and post-operative MMP7 levels. So for the meta-analysis, we drafted the following question: can preoperative MMP serum and plasma levels predict disease progression in urothelial carcinoma? We used the PICO framework for urothelial cancer patients treated with surgery or systemic therapy, high and low level MMP7, levels, and the main outcome was overall survival. And we also hypothesized that MMP serum and plasma levels are prognostic indicators of urothelial cancer patients' outcome. Here you can see our selection of articles. We had more than 450 articles, and at the end we had 6 eligible articles for full text selection. And our main outcome was overall survival. And using a random effect model and the pooled analysis, the hazard ratio of 2.69 showed there is significant association with higher pretreatment MMP7 levels and poorer overall survival. So there are strengths for our meta-analysis, which means this was the first meta-analysis regarding MMP7 for urinary bladder cancer patients. We performed an additional post-hoc cohort analysis regarding surgical decision-making, and we also had our limitations regarding the cutoff values of MMP7, and we only examined the serum and the plasma levels, and they all were retrospective studies. So for summary, we can conclude that MMP7 has a prognostic value in high-grade urothelial cancer patients and muscle-invasive bladder cancer patients with lymph node positive disease, and high MMP7 levels have poorer prognosis. So we submitted our article in March, and we published in April in MDPI, International Journal of Molecular Sciences. Moving to my second project, which is a comparison of radical and organ-sparing treatment modalities for non-metastatic small cell bladder cancer. It will be a systematic review and a meta-analysis. You have to know about neuroendocrine bladder cancer, which is a very rare entity. These patients have early metastasis, and they have a very poor prognosis. So my aim was to find the optimal treatment for small cell neuroendocrine carcinoma patients. Looking through the literature, we're using the EAU guidelines, and there is no strict treatment for this kind of patients, and there is written that they have to be treated individually. And using the Veterans Administration staging method, the non-metastatic limited disease has 2 approaches to treat, and we can choose between radical cystectomy and perioperative chemotherapy, or bladder-preserving concurrent chemoradiotherapy, like in limited stage small cell lung cancer. We drafted the following question for these patients. What is the optimal treatment for patients with non-metastatic small cell bladder cancer? We used the PICO framework. The population was small cell bladder cancer patients. The intervention was radical cystectomy and perioperative systemic therapy, and the comparator was bladder-preserving and concomitant chemoradiotherapy, and our main outcome was overall survival. And we hypothesized that radical cystectomy did not influence overall survival in the patients with non-metastatic disease. You can see our article selection. We had more than 1,600 articles, and at the end, 5 eligible full text for selection. And using the Kaplan-Meier curves from different articles and extracting data from these, our main outcome was overall survival, and we use individual patients' data from these Kaplan curves, and the hazard ratio of 1.12 showed that there is no significant difference between the 2 therapeutic options. So there is no superiority of a radical procedure in that case. My summary for the first topic, we are lucky enough to submit it, and we published it in April. And the second topic is still in progress, and we hope that we can finish it by September or October and publish it. Thank you for your attention, and I would like to close my presentation with the words of Wayne Gretzky: you miss 100% of the shots you never take. So thank you very much.
So you measured MMP7 in serum samples and evaluated for its prognostic value. How could it change your clinical practice? What would you change based on a high or low MMP7 serum level?
So in that cases, micrometastasis can be missed. So if we have a muscle-invasive bladder cancer patients and we operate them, and after the operation, we cannot prove that there is any metastasis. That means either the radiologist before the operation did not prove, or after the operation, the pathologist could not prove that there is any metastasis. But we have elevated MMP7 levels, and we have this association with metastasis. Then we can tell these patients to get early therapy, immunotherapy after the operation, so we do not have to wait till these patients metastatize. We can give them early immunotherapy or chemotherapy after the surgery.
Okay, thank you.
I'm sorry, maybe I didn't catch it, but is it a cheap method to follow patients with cancer, bladder cancer, to measure the MMP7 levels, or is it very expensive? So is it useful? Can be a useful method for screening?
It can be used. So it's not a really expensive method. So like every biomarkers, it can take time, and there are different methods like ELISA to examine these marker levels, but it can be used in the clinical practice, and we also use them in the daily routine.
Just regarding your second paper, so you did not find any difference between the surgery and between the chemotherapy. Do you have any data regarding the side effects of these treatments from the patients, or because you know that how could it be interpreted so that it's better not to operate whenever the radical cystectomy, it has almost the same, so that I'm just wondering whether what is better, to be removed or to be given chemotherapy.
For the first case, we choose the bladder preserving therapy. That means transurethral resection, chemotherapy, and after radiotherapy. This is a multimodal therapy. In that case, the quality of life for these patients could be better. But the other case, the radical cystectomy, we perform it usually. Then we perform a radical cystectomy, and after these patients may have some side effects and some problems after this operation, and that's why if we can choose the multimodal treatment, then it can be also an option.
Thank you very much.